Please join us in the hall for the first session. Under leadership of Dr. P.K. Singh, friends, those who are still in the corridor, can you join us inside the hall? Okay. I have great pleasure in introducing our faculty for the first session, Dr. Femi Oyebode. He is from Birmingham, UK. He has done his MBBS, MD, PhD, FRC Psych, Honorary, and Medicine in the University of Ibadan, graduating with distinction in the year 1977. He has been trained as a psychiatrist in Newcastle upon Tyne. Newcastle upon Tyne is the place where Shakespeare worked. It's a land of Shakespeare's birth. And he has been professor of psychiatry at the University of Birmingham since 1999. He has published over 225 original papers, 23 book chapters. His books include Mind Reading, Literature and Psychiatry, Madness at the Theatre, Sims, The Symptoms in Mind, Textbook of Descriptive Psychopathology, 4th and 7th editions, translated into Arabic, Estonia, Italian, Korean, Mandarin, Portuguese and Spanish. Psychopathology of the Rare and Unusual Syndromes, analyzing doubts across antiquity, fiction, psychopathology and neuroscience. He is the apt person for the first session. Are you on the line? Are you online, Femi? Is he online? Can we have him on the screen? Femi ko screen pe le aao bhai. Yes. So it's a great pleasure to welcome you. And I am Shiv Gautam, Chairman of the Reception Committee and Chairperson for this session. Dr. Alok Tyagi is a Professor of Psychiatry from the Psychiatric Center attached with SMS Medical College. He is co-chairing with me and we have great pleasure. The hall is full and we all want to listen to you.
Thank you, sir.
You are welcome, please.
Thank you. Thank you very much, sir, for your very kind and generous introduction. I hope you can all hear me all right. I want to thank you for inviting me to speak at this meeting. I'm terribly sorry that I've not been able to come in person, and that's only because I've got another commitment for tomorrow in Portugal, in Lisbon. I want to thank Dr. Asta Sharma in particular, because I think that she put my name forward. So I'm very grateful to Asta for putting my name forward. So what I want to do in the next 20-25 minutes is to speak about the role of literature, of the humanities in psychiatry. So I'll say a few words for about 4 or 5 minutes on what the role of the humanities are, and say a bit about trying to locate my presentation in the context of the medical humanities. And then I'm going to concentrate on how the humanities, literature in particular, can help us to deepen our appreciation, our understanding of using depression as an example. And then I'll try and draw things to a close. So I think that the humanities and literature in particular in psychiatry and in medicine, they become very, very pivotal in medical curriculum up and down the world, but particularly in the US and in Western Europe. And you might ask the question, Why is that? Why is that the case? And I think a simple answer would be to say that there's a recognition that there's an excessive intrusion of technology into medicine, and also that the subjective experience, the personal perspective of the patient themselves has been lost in clinical practice. And you could argue that the humanities, what they've done is to reintroduce the humane or the human into a technical field such as ours, which is medicine and literatures. So the humanities, for these purposes, include the application of moral philosophy, as in ethics, the kind of involvement of the social history of medicine, and then, of course, my own particular interest, which is in the application of literature or indeed of the fine arts into medical practice. Usually, my sources in terms of my own research and teaching will include autobiographical narratives, so accounts written by people who themselves have had a physical illness or a psychiatric disorder, or fictional narratives which are based on illnesses or diseases that people have suffered. And I also use letters, poetry, the theater, so drama, and also use diaries. And you might ask, how is this? How might the humanities inform medicine, inform psychiatry? And I suppose there are 4 or 5 ways in which the humanities might assist doctors and psychiatrists. The first is that it gives us an account of the life of the patients. So it gives us an account of how a disorder, a disease affects a patient in their life, which of course the clinical diagnoses just do not do that. Secondly, it gives us an idea of how the doctor's actions are perceived and understood by patients. So if you've got an account, if you've got an autobiographical account of illness, which refers to how the person experienced medicine, experienced doctors, that gives doctors an insight into how their behaviors and their actions are received by patients. And you might also say that we human beings, we live in a world, I hope you can still hear me, that we live in a world which is embedded in language, and that literature in particular assists in helping us to understand how language works. It teaches us the same skills that we have when we read a novel or we read a poem. To understand the novel or the poem are the same skills that we need to freshen, to refresh when we're in a clinical encounter with a patient. So literature teaches us how to attend to language, how to attend to what somebody is saying, how to understand what is not being expressed, how to understand what is being said in between the lines, and how to understand, properly speaking, why a person is chosen to use a particular word and not another. So you could say that the same skills that we need in order to read a piece of work, a piece of literary work, are the same skills that we require in order to understand our patients. And next to that is this idea that the humanities in particular teach us that there's not only one way of looking at the world, so that the literature teaches us that there are multiple perspectives, which is a wonderful gift to clinicians. So it helps us to see that there are multiple perspectives. This is not necessarily a problem for psychiatrists, because psychiatrists properly understand that there are multiple perspectives. So you've got a clinician's perspective, you've got the patient's own perspective of the condition, you've got the family's own perspective on the condition, and we've also got a kind of community kind of perspective. So psychiatrists have always understood this, but you could say that the rest of medicine maybe do not have as deep an understanding of the fact that there are multiple perspectives on the given condition. and that literary criticism or literary scholarship helps us to properly appreciate how multiple perspectives exist in the world, and that these multiple perspectives are relevant to clinical practice. So what I want to now do is to exemplify how literature might assist us with a deep appreciation of a condition like depression that we see on a day-to-day basis in our clinics. And I want to start off exemplifying this, given an example from the writing of a Japanese poet, Kobayashi Issa. So Kobayashi Issa is one of three classical figures in Japanese haiku. So he's along with Basho and Buson. But I've chosen to concentrate, to focus on Kobayashi Issa because he wrote about what it felt like to lose his daughter to smallpox. So I'll just read that to you. And he says, "It is often said that the greatest pleasures result in the greatest misery. But why is it that my little child, who has had no chance to savor even half of the world's pleasure, who should be green as new needles on the eternal pine, why should she be found on her deathbed, puffy with blisters raised by the despicable god of smallpox? How can I, her father, stand by and watch her fade away each day like a perfect flower suddenly ravaged by rain and mud? 2 or 3 days later, her blisters dried to hard scabs and fell off like dirt softened by melting snow. Encouraged, we made a tiny boat of straw and poured hot sake over it with a prayer and sent it floating downriver in hopes of placating the god of the pox. But our hope and efforts were useless, and she grew weaker day by day. Finally, at midsummer, as the morning glory flowers were closing, our eyes closed forever. Her mother clutched her cold body and wailed. I knew her heartbreak, but also knew that tears were useless, that water under the bridge never returns, that scattered flowers are gone forever, and yet nothing I could do would cut the bonds of human love." So I start with that bit of writing by Kobayashi Issa, Japanese haiku poet, really to show how literary works definitely deepen our appreciation of the nature of grieving, of grief. And that just looking at the clinical features of grieving, of a normal bereavement reaction, is not in itself adequate to capture the pathos that the patient, the person experiences. And so that's, that is the purpose of using literature, to find a way to deepen our grasp, our appreciation, our understanding of the nature of these experiences. I want to draw your attention, of course, to Shakespeare, which we cannot be talking about literature without talking about William Shakespeare. And I want to use Shakespeare's Hamlet as a means of, again, deepening our understanding of anhedonia. And anhedonia, which is some people would argue, is a core feature. It is a core feature of a depressive state. And I don't think that you can have a better appreciation of these symptoms. So this the feelings captured by Hamlet to describe what it feels like, how one displays one's inner feeling. And Hamlet, obviously speaking, he says, "'Tis not alone my inky cloak, good mother, nor customary suits of solemn black, nor windy suspiration of forced breath, no, nor the fruitful river in the eye, nor the dejected behavior of the visage, with all forms, moods, shows of grief that can denote me truly. These indeed seem, for they are actions that a man might play, but I have had that within which passeth show. These but be the trappings and suits of woe." So that's Hamlet. And Hamlet is doing a wonderful piece of work, especially for trainees, for trainee psychiatrists. So he's showing us that the colors that people wear, he's showing us that if a person wears a dark cloak, that might indicate something about their inner life. That if somebody is sighing, that might tell us something about how they're feeling inside. And if they're crying, so the fruitful river in the eye, and the dejected behavior of the face, that these are features of depression. And I personally do not know a better way of teaching a young doctor, a young psychiatrist, the clinical expressions, the manifestations, the display of inner anguish or inner sadness. So that's Shakespeare. And then I want to use the example of William Styron, an American writer who is now passed away, and who himself suffered from depression. And he wrote about his sadness, wrote about his depression in a book, very short book of about 70 pages, which is called Darkness Visible. It's another book which psychiatric trainees might want to read. It's very, very short, an absolutely wonderful description of what it is like to be depressed. And he says, this is William Styron speaking, he says, depression is a disorder of mood so mysteriously painful and elusive in the way it becomes known to the self as to verge close to being beyond description. It thus becomes and remains nearly incomprehensible to those who have not experienced it in its extreme mode. The pain of depression is quite unimaginable to those who have not suffered it, and it kills in many instances because its anguish can no longer be borne. So you've got Styron, William Styron. What you've got him doing there is helping us to see that depression is practically indescribable, and that we have to use metaphors in order to capture the depth and severity of it. And so the real point there is that he's comparing it to pains. Actually, he uses a word which he invents for it. He calls it a psychalgia, which is a word which is similar to neuralgia. So he says that it's a psychalgia, and that it is absolutely indistinguishable from physical pain. And I think that's very helpful for us, because that is not in DSM. That is not in ICD-10. So it helps a psychiatrist to understand the degree and the nature and the severity of the anguish which our patients suffer. And Kay Redfield Jemison, who is herself a clinical psychologist, who's a professor of clinical psychology in America, who is a leading figure in the study and understanding of bipolar disorders, who she herself has bipolar disorder and has responded well to lithium. And she has a wonderful autobiographical memoir of her experience of bipolar disorder, which is called An Unquiet Mind. Again, it's a very slim book. It's a book which I recommend to trainees. And she says, and I'm quoting her, she says, depression is awful beyond words. I would not go through an extended period again. It bleeds relationships through suspicion, lack of confidence and self-respect, the inability to enjoy life or walk or talk or think normally, the exhaustion. There's nothing good to be said about it, except for it gives you the experience of what it must be to be old, to be lacking in grace and polish and coordination, to be ugly, to have no belief in the possibilities of life, the pleasures of sex, the ability to make yourself or others laugh. Depression is flat, it is hollow, it is unendurable. People cannot abide being around you. So you get the depth of it, you get the absolute wonderful description, which again enriches the kind of symptom list that we have in psychiatric systems, in the compendium of psychiatric disorders as you find in the DSM or the ICD-10. And then I'm getting close to towards the end of my talk, and I want to draw your attention to Virginia Woolf, the famous British novelist, who had recurrent depression, had psychotic depression, and ultimately killed herself. So I want to use Virginia Woolf's suicide letter to give you a grasp of what it is like before somebody takes their own life. And Virginia Woolf, we know that she sat down and wrote this letter in longhand and left it on her desk, on her working desk, where she normally wrote her novels in longhand, and then slipped out of the side door, the side entrance to her house, and walked down the side of her garden and walked into the river, with the river Ouse, and she put stones and rocks in her pockets so that she would drown. So this letter that I'm about to read out to you, it's very poignant, isn't it? Full of pathos, because we know that she dies within 20 minutes of having written this letter. And again, it gives you an inside understanding of the state of mind of a person who takes their own life in this sort of way. So this is writing this letter. It's addressed to her husband. And she says, "Dearest, I feel certain that I'm going mad again. I feel we cannot go through another of these terrible times, and I shan't recover this time. I begin to hear voices. I cannot concentrate, so I'm doing what seems the best thing to do. You have given me the greatest possible happiness. You have been in every way all that anyone could be. I don't think two people could have been happier till this terrible disease came. I can't fight any longer. I know that I'm spoiling your life, that without me, you could work, and you will, I know. You see, I can't even write this properly. I can't read. What I want to say is that I owe all the happiness of my life to you. You have been entirely patient with me and incredibly good. I want to say that. Everybody knows it. If anybody could have saved me, it would have been you. Everything has gone from me, but the certainty of your goodness. I can't go on spoiling your life any longer. I don't think two people could have been happier than we have been." And she signs it, V. So it's a brilliant letter for especially for trainees. It's a wonderful letter because as doctors, as psychiatrists, we get to hear that our patients have died, but we don't get any kind of understanding of the inner life, the moments before they take their own life. We have no sense of what it feels like to them. And here you've got this letter, which gives you all the features of depression. So it tells you that she has negative thoughts, that she thinks she's not going to recover, and that's not true because she's recovered in the past. She tells you that she's got psychosis because she's got auditory hallucinations, verbal hallucinations. It tells you that her concentration is impaired. And it tells you of the nature of hopelessness, the idea that things are not going to get better. And it also tells you of the heightened sense of responsibility that people with depression have, which sometimes when it's very severe, we see it as psychotic guilt. So she's saying that she's spoiling her husband's life when there's no good reason to believe that she's done that. So I hope what I've done in this very, very short presentation to you, I hope what I've done is I've shown how extraordinarily valuable literature is to our understanding of psychiatric conditions. I hope I've shown you that the list of symptoms that you have in ICD-10 and DSM, that they're insufficient to give the depth, the richness of the human experiences that people have. And that as doctors, there's nothing better than having a fellow feeling, a deep kind of sense of empathy for the patients that we look after. And that literature arms us with this empathy because it gives us the depth of and the richness of the experiences that they have, which then allows us to ask the right questions and allows us to be able to interact and relate to them in a way that they appreciate, properly speaking. So I'm very pleased to have been speaking to you, and thank you very much for listening to me. Thank you.
Thank you very much, Femi, for joining us.
Pleasure.
It has been a great listening to you.
No question?
No. So you have shown us the path, how literature, what the interface between literature and mental health. And you have rightly said that many things which we do not find in symptoms of ICD can be learnt through the literary writings of the poets. Well, you have talked about some of the literary scholars of UK who have mentioned their feelings and expressing the emotions. Similarly, we have, you did not mention Wordsworth, his famous poetry, The Daffodils, wherein he talks how short the life is, and he talks about various human emotions. In India, we have had several poets, literary figures who have expressed their feelings, and one popularly known as Ghalib. Mirza Ghalib was a bipolar. It has been said by several people. वो न थी हमारी किस्मत की विसाले यार होता, अगर और जीते रहते यही इंतजार होता. The famous share by Ghalib, written during the depressive phase. And you see many of the Ghalib's poetry in stage of mania as well, if you read Ghalib thoroughly. One of the famous writers from Rajasthan, I should mention his name, Sharad Devda. Late Sharad Devda is no more. He was a popular novelist. He wrote several books, and he was editor of a daily called Animo. He suffered from depression, and I had the privilege of treating him. When he suffered from depression, he expressed not to do anything. I said, no, Sharad, you have to start writing again. And when he came out of depression, two of his famous books, Akash Ek Aap Biti, which was written on his personal life, wherein in the preface, he mentioned openly during those days when mental illness was a stigma. Sharad Devda writes that I am grateful to my psychiatrist, Dr. Shiv Gautam, who motivated me to write once again. And then his very famous book, Premi Premika Samvad, which is a book on Brahmabhat, you should read it. It's a book on sexology. It's a book on how sexual relationship and sexual health can be kept well. And that book, I had written a preface for this book. And that is how literature helps people to come out of their mental crisis, depression. And you have served very well written, since it is a keynote address, and we don't have question answer on a keynote address. So I have, as a chairman of the session, I have had the privilege to make some comments. You have very wonderfully deliberated. Thank you very much.
Thank you, sir.
I'm happy that the time in Birmingham is around 11 o'clock in the morning now. So you are
It is,
comfortable.
yes.
But
Thank
our
you, sir.
US friends find it difficult to talk at this time. With this, I give the floor to my co-chair, Dr. Alok Tyagi, for the note of thanks.
Thank you, sir.
Thank you, Dr. Femi, for telling us insight into understanding of psychological aspects of psychiatry. Nowadays, psychiatry has become very much biological, but you have given a great insight that understanding human emotions and most important, depression can be the understanding of depression can be understood through poems, stories, where these world-renowned poets and story writers, they have expressed depression in so many ways. And there is take-home message for our psychiatric students that merely studying textbook of psychiatry does not give you deep insight into depression. Like, for understanding depression, I think that they should probably read poems. They should understand stories, elaborates emotions and their expressions. Like understanding psycholinguistic is very difficult subject, and for understanding that psycholinguistic, one should go through different books apart from psychiatric. Now, I would like to welcome any question.
No, questions. It's a keynote address.
Pardon?
It's a keynote address, so we don't have questions.
Okay.
So we thank you very much, sir.
Thank you, sir.
Thank you so much for your
Great pleasure to me, sir.
for your
Thank
deep
you so much,
insight
sir.
to the from the side of audience and everyone. Thank you so
We thank
much.
Dr. Femi Oyebode. We thank our
Thank you.
chairpersons.
And thank you, audience,
Thank you,
for
sir.
a great participation.
Thank you, sir.